Your body whispers warnings days before a stroke, but most people mistake them for stress, fatigue, or bad sleep. What if the signs you ignore today are the last clues your brain will ever give you? Welcome to Wellness Unfolds, where we reveal the hidden truths about your health and empower you to live a longer life. Many believe a stroke strikes like lightning, appearing out of nowhere without warning. But this is often a dangerous misconception. Research shows that the body often signals distress days or even weeks before a major stroke event actually takes place. These early warning signs are frequently ignored or dismissed as minor ailments, leading to missed opportunities for early life-saving intervention. Understanding these subtle clues can be the difference between a full recovery and permanent damage, or even life and death. Today, we will uncover the 7 critical warning signs that your body sends when a stroke is looming on the horizon. To understand the signs, we must first appreciate the delicate balance of blood flow that keeps our brain functioning perfectly. Your brain requires a constant supply of oxygen and nutrients to maintain the complex network of neurons that control your body. The first and most significant warning sign is consistent high blood pressure, which is often referred to as the silent killer. Chronic high blood pressure puts immense strain on your arterial walls, slowly weakening them over time without you feeling any pain. This continuous pressure can eventually lead to a rupture or contribute to the formation of blockages within the brain's blood vessels. If you notice your blood pressure remaining high despite medication or lifestyle changes, it is a serious red flag to address. Doctors recommend regular monitoring because this condition rarely has physical symptoms until the damage to your arteries is already severe. Your heart has to work much harder to pump blood, which increases the risk of clots traveling up to the brain. Sometimes, high blood pressure manifests as subtle anxiety or flushing, but reliance on these symptoms is dangerous. Measurement is the key. Damage to small blood vessels in the eyes can also indicate that similar damage is happening within the brain's vascular system. Managing this single factor can significantly reduce your stroke risk, making it the most important preventative measure you can possibly take. Excessive salt intake and chronic stress are major contributors to this condition, acting as fuel for the fire of hypertension. Simple practices like deep breathing and reducing sodium can start to lower your numbers and protect your brain almost immediately. The second warning sign is unexplained excessive fatigue, a profound exhaustion that does not improve even after a full night's sleep. This is not just feeling tired after a long day. It is a systemic weakness that makes simple tasks feel impossible. This fatigue often occurs because the brain is struggling to maintain consciousness due to restricted blood flow and limited oxygen delivery. When the arteries narrow, the heart and brain must work overtime to compensate, draining your body's energy reserves very rapidly. Patients often describe the sensation as walking through mud or feeling like their limbs are made of heavy lead or stone. This symptom is particularly common in women and can appear weeks before the actual stroke event occurs, serving as a warning. If you experience a sudden drop in energy levels without a clear cause like illness or exercise, pay close attention. Consulting a healthcare professional about sudden fatigue can reveal underlying vascular issues that might otherwise go unnoticed until it is too late. The third sign involves sudden vision problems, which can manifest as blurriness, double vision, or even a temporary loss of sight. The eyes are direct extensions of the brain, so when blood flow to the brain is compromised, vision is often affected. You might struggle to focus on text or see dark spots floating in your field of vision that were not there. Double vision is a serious neurological sign indicating that the brainstem, which controls eye movement, is not receiving enough blood. Some people experience a curtain-like shadow falling over one eye, a condition known as amaurosis fugax, signaling a carotid artery issue. It is easy to dismiss these symptoms as aging or eye strain, but sudden changes warrant an immediate emergency medical evaluation. These visual disturbances are often caused by tiny clots that temporarily block blood flow to the retina or the visual cortex. An eye exam can sometimes reveal the first clues of a stroke risk, as the blood vessels there are clearly visible. Vision loss while driving or operating machinery can be fatal, not just from the stroke itself, but from the resulting accidents. The fourth sign is a sudden, severe headache, often described by survivors as the worst headache they have ever felt in life. Doctors call this a thunderclap headache because it strikes with maximum intensity within seconds, unlike a migraine that builds up slowly. This pain is distinct from tension headaches or migraines. It is explosive and often localized to a specific area of the head. This symptom is more common in hemorrhagic strokes, where a blood vessel ruptures and the leaking blood irritates the sensitive brain tissue. A headache that wakes you from sleep or changes significantly with body position is a major red flag that requires attention. If the headache is accompanied by a stiff neck, vomiting, or altered consciousness, call emergency services immediately without any hesitation. The pain results from rapidly increasing pressure inside the skull, which can compress brain structures and lead to permanent damage quickly. Standard painkillers will not relieve this type of headache, and waiting for them to work can waste precious time for treatment. Do not attempt to drive yourself to the hospital if you experience this. Professional medical transport is safer and much faster. The fifth warning sign is sudden numbness or weakness, typically affecting the face, arm, or leg on just one side. Since each side of the brain controls the opposite side of the body, a stroke usually affects only one lateral side. A simple test is to try raising both arms. If one arm drifts downward involuntarily, it is a classic sign of stroke. Facial drooping is another manifestation. If one side of the face feels numb or looks uneven, immediate action is absolutely required. These symptoms might last only a few minutes and then disappear. This is called a transient ischemic attack, or mini-stroke. A mini-stroke is a major warning shot. It means a massive stroke could be imminent, often occurring within days or weeks. The sensation might feel like pins and needles or a complete loss of sensation, making the limb feel foreign to you. Loss of fine motor skills, such as being unable to hold a pen or button a shirt, can be an early indicator. Neurologists test for this weakness to localize exactly which part of the brain is being affected by the lack of blood. The sixth sign is difficulty in communication, which includes slurred speech, trouble finding words, or not understanding what others are saying. This occurs when the stroke affects the language centers of the brain, typically located in the left hemisphere for most people. You might know exactly what you want to say, but the words come out garbled, slurred, or completely nonsensical to listeners. Conversely, you might hear others speaking but fail to comprehend their words, as if they are speaking a completely foreign language. A common test is to ask the person to repeat a simple sentence. Inability to do so clearly is a strong sign. This state of aphasia can be terrifying and isolating, but recognizing it quickly is crucial for getting help to restore function. If a loved one suddenly starts speaking gibberish or cannot speak at all, note the time and call emergency services immediately. Recovery of speech is possible, but it largely depends on how quickly blood flow was restored to the brain's language centers. The seventh category includes other neurological issues such as sudden dizziness, loss of balance, confusion, or an unexplained sense of nausea. The cerebellum controls balance and coordination. If its blood supply is interrupted, you may feel like the room is spinning violently. This vertigo is sudden and severe, different from the lightheadedness you might feel from standing up too quickly or being hungry. Nausea and vomiting without a stomach virus can occur because increased brain pressure stimulates the vomiting center in the brainstem. Sudden confusion or memory loss, such as forgetting where you are or what you were doing, is another subtle warning sign. Recognizing any combination of these 7 signs allows you to act fast, which is the most critical factor in stroke survival. To better understand these risks, we need to distinguish between the 2 main types of stroke: ischemic and hemorrhagic stroke. Ischemic stroke is the most common type, accounting for about 87% of all cases caused by a blockage in a vessel. This blockage is often the result of atherosclerosis, where fatty deposits clog the arteries, eventually cutting off oxygen to the brain. Hemorrhagic stroke is less common, but often more deadly. It happens when a weakened blood vessel ruptures and bleeds into the brain. The accumulated blood puts extreme pressure on brain cells, damaging them rapidly. High blood pressure is the leading cause of this type. Doctors must determine which type of stroke is occurring using a CT scan because the treatments for them are completely opposite. For a blockage, doctors administer clot-busting drugs, but giving these to a bleeding patient would be fatal, hence the need for scans. For a bleed, surgery might be required to repair the vessel and relieve pressure, a delicate procedure requiring immense medical skill. The good news is that up to 80% of strokes can be prevented with the right lifestyle changes and medical management. First and foremost, control your blood pressure. Keep it under 120/80 through medication, diet, and regular checkups. Manage diabetes carefully. High blood sugar damages blood vessels over time, making them more likely to form clots or to rupture. Keep your cholesterol in check. High levels of bad cholesterol create the plaques that lead to blockages in your carotid arteries. Adopt a Mediterranean diet, rich in fruits, vegetables, whole grains, and healthy fats like olive oil to protect your vascular health. Reduce sodium intake significantly. Excess salt retains water in the body, raising blood volume and consequently increasing your blood pressure. Aim for at least 150 minutes of moderate exercise per week to strengthen your heart and improve blood circulation. Stop smoking immediately. Smoking thickens your blood and increases plaque buildup, doubling your risk of having an ischemic stroke event. Limit alcohol consumption. Excessive drinking can raise blood pressure and contribute to irregular heartbeats like atrial fibrillation, a stroke risk. Maintain a healthy weight. Obesity is linked to high blood pressure, diabetes, and sleep apnea, all of which increase stroke risk. Prioritize quality sleep. Sleep apnea, a condition where breathing stops during sleep, deprives the brain of oxygen and raises blood pressure. Find healthy ways to manage stress. Chronic stress floods the body with hormones that can damage arteries and elevate blood pressure. Regular checkups are vital. Many risk factors are silent, and only a professional can detect them before they become emergencies. By taking these steps, you are not just protecting yourself, you are preserving your future and your time with loved ones. Prevention is always better than cure. Small daily choices add up to create a powerful shield against this life-threatening condition. Finally, always remember the acronym FAST: face drooping, arm weakness, speech difficulty. Time to call emergency services immediately. F stands for face. Ask the person to smile. Does one side of the face droop or feel numb and unresponsive? A stands for arms. Ask the person to raise both arms. Does one arm drift downward or is it unable to rise? S stands for speech. Ask the person to repeat a simple phrase. Is their speech slurred, strange, or hard to understand? T stands for time. If you observe any of these signs, call emergency services immediately. Time lost is brain lost. Quick treatment can reverse the effects of a stroke, but the window of opportunity is very short, often just a few hours. Your awareness and quick reaction can save a life, perhaps even your own, or that of someone you love dearly. At Wellness Unfolds, our mission is to provide you with the knowledge you need to navigate your health journey with confidence. Listen to your body. It whispers before it screams. Paying attention to the whispers can prevent the scream of a stroke. Share this information with your friends and family. Building a community of awareness is the best way to protect everyone. If you found this video helpful, please share it. You never know whose life you might save with this simple action. Always consult with your healthcare provider for personalized advice, as every individual's health profile and risk factors are unique. Protecting your brain health ensures that you can enjoy your golden years with clarity, independence, and joy. Stroke is not just an old person's disease. Prevention starts now, regardless of your age, by building healthy habits today. A healthy heart leads to a healthy brain. The connection between the two is inseparable and vital for your existence. Stay hydrated. Water helps keep your blood less viscous, making it easier for your heart to pump it to your brain. Laughter and social connection are powerful medicines. They lower stress and improve vascular function in ways science is just beginning to understand. Remember the 3 pillars: nutritious diet, regular movement, and mental peace. Balance these, and you build a fortress against stroke. Do not wait for a crisis to start caring for your body. Proactive health management is the ultimate act of self-love. Life is a beautiful journey, and your health is the vehicle that allows you to explore it to the fullest extent. Consider keeping a health journal. Tracking your numbers and habits can reveal patterns and motivate you to stay on track. It is never too late to start. Even if you have risk factors, small changes today can change your trajectory tomorrow. If you are a caregiver, your vigilance is a lifeline. Watch for these signs in your loved ones, who may not notice them. Recapping our journey, watch out for the silent killer of high blood pressure and that deep, unexplained fatigue that lingers. Do not ignore sudden changes in your vision, or that explosive thunderclap headache that feels different from anything you know. Pay attention to numbness on one side, difficulty speaking or understanding, and sudden loss of balance or coordination. Make a promise to yourself right now. If you haven't had a checkup recently, schedule one this very week. Get some sunlight and fresh air. Vitamin D deficiency has been linked to an increased risk of stroke and heart disease. Cook at home more often. This gives you complete control over ingredients, especially salt and fat, protecting your arteries. Become a label detective. Hidden sodium and trans fats in processed foods are enemies to your vascular system's integrity. Incorporate omega-3 rich foods like walnuts and fatty fish into your diet to reduce inflammation and support brain health. Eat plenty of berries. Their high antioxidant content helps protect your blood vessels from oxidative stress and inflammation. Swap sugary drinks for green tea. It contains compounds that improve blood flow and lower cholesterol, boosting brain protection. Look for opportunities to move. Take the stairs, park further away, or stand while talking on the phone to stay active. Keep an eye on your waistline. Abdominal fat is metabolically active and releases harmful substances that damage blood vessels. Technology can help. Use smartwatches to monitor your heart rate for irregularities that might suggest atrial fibrillation. Yoga and stretching keep your arteries flexible. Stiff arteries force the heart to work harder and increase stroke risk. A little dark chocolate is okay. In moderation, high cocoa chocolate can actually improve blood flow and lower blood pressure. Spend time with pets. The companionship of an animal has been scientifically proven to lower blood pressure and reduce stress. Find purpose in your life. Engaging in meaningful activities keeps the brain active and reduces the risk of cognitive decline. Challenge your brain. Learning new skills creates new neural pathways, making your brain more resilient to damage and aging. Short power naps can be beneficial, reducing stress hormones, but ensure they don't interfere with your nighttime sleep quality. Do not neglect oral hygiene. Gum disease is linked to inflammation in the body that can affect your heart and arteries. Avoid polluted air when possible. Long-term exposure to particulate matter can trigger inflammation and harden your arteries. If you are prescribed medication, take it exactly as directed. Skipping doses can lead to dangerous spikes in blood pressure. Know your family history. If parents or siblings had strokes, your risk is higher, requiring even more vigilant prevention. Women should monitor blood pressure during and after pregnancy. Preeclampsia is a strong predictor of future stroke risk. Avoid illicit drugs entirely. Substances like cocaine and methamphetamines can cause sudden, massive strokes, even in very young, healthy people. Ask your doctor to check for atrial fibrillation. This irregular heartbeat allows blood to pool and clot inside the heart. You have the power to change your story. Your genetics load the gun, but your lifestyle pulls the trigger. Be the hand that stops the dominoes from falling. One positive change today can break the chain of disease progression. Join the movement towards better health. Every step you take, every healthy meal you eat is a victory for your future. We hope this deep dive into stroke warning signs has armed you with the knowledge to protect yourself and others. Do not let this information frighten you. Let it empower you to make the changes necessary for a vibrant life. Your life is a precious story meant to be long and full of chapters. Do not let it end prematurely. Please support our mission by liking this video. It helps the algorithm spread this life-saving message to people who need it. Leave a comment below sharing your own health tips or experiences. We love hearing from our Wellness Unfolds community. Stay tuned for our next video where we will continue to explore the fascinating science of the human body. Thank you for watching Wellness Unfolds. Subscribe for more life-saving insights, and remember to prioritize your health every single day.